Let's talk about the new kid on the block or a new IPO, IKS. And this company is unique. Unique because it is in a very unique niche medical healthcare services. It's a company which is backed by Rakesh Jhunjhunwala, and they are going public at a time when markets in a sense are really worried about how essentially the Indian outsourcing or Indian IT outsourcing model would move and evolve because of destructive forces or destructive technologies like AI. It's a company where Rare Enterprises invested 17 years ago, and their investment has become not twofold or threefold, but it's been a multi-bagger for them, where the investments in last 17 years has grown up by nearly 350 times. So what is so unique about this company where late Rakesh Jhunjhunwala had invested and picked up a large substantial chunk 17 years ago? To understand more about the company and the IPO, I'm now joined by the founder, Sachin Gupta. He's the founder and the CEO, and Nithya Balasubramaniam, the CFO. Nithya, Sachin, thank you for joining us on ET Now.
Thank you so much for having us, Nikunj. Great to talk to you all and your viewers. It's a little overwhelming to hear that introduction. We, of course, have been just doing our work over these last 18 years, trying to enable the delivery of better, safer, more efficient care for healthcare providers in the US. And yes, it does look like, based on the math, it could be up to about 350 times returns over these last 17 years for Rakesh Bhaiya's investment.
So you're making the impossible look easy. Tell us more about the company, how you started, where you are, and where are you on the growth curve? Like Ashwas Damodaran always says that every company goes through a curve. The startup curve, then is the youth curve, then there is the maturity curve. Where are you in that growth curve?
Great question, Nikunj. Thank you. So, look, I think, as you know, the US healthcare industry is the largest industry in the world at about $4.8 trillion. We all speak about the opportunity in India, $3.5 trillion economy growing at 6 to 7%. Well, here's US healthcare, $4.8 trillion, growing at 7.5 to 8% with no cyclicality. And even though US healthcare lives in the capital of capitalism, or the temple of capitalism, US, actually it has never really leveraged the two key pillars on which capitalism stands, technology and globalization, effectively. And we basically saw that opportunity 17 years ago to bring the right combination of proprietary technology and global human capital to basically alleviate the burden of chore tasks from these healthcare providers so that they could focus on their core. And in the process, enable them to deliver, first of all, better care, better quality care, improve access to care, and in the process, reduce the cost of care. Because at $4.8 trillion, America spends nearly 20% of GDP on healthcare, which is more than any other advanced economy in the world. And like I said, healthcare in the US is growing at 7.5 to 8%, which is much faster than their GDP. So obviously there's a cost problem. There is an access to care problem where new patient wait times today in the US are as high as 45 to 60 days for primary care and 6 to 9 months for specialty care. So you have an access to care problem with the population that is aging, lifestyles that are becoming sedentary, and patients needing more and more care due to the prevalence of chronic diseases, which is why there is no cyclicality in the growth, and the number of patients that need care is growing much faster than the number of doctors, nurses, providers to provide the care. And then last but not the least, due to the heavily regulated nature of the US healthcare industry, providers that actually need to see more and more patients during the day are being burdened by more and more regulation-driven chore tasks that are taking them away from the task of taking care of patients, which is their core.
Thank you for articulating your business for us, and thank you for sharing with our viewers. But Nithya, my follow-up question is that how should one look at IKS differently from an IT outsourcing model? Because the whole construct of IT outsourcing model is also based on cost arbitrage. What is different about health arbitrage model?
Sure, Nikunj, and it's fabulous to be back talking to you as well as talking to your viewers. So we are actually quite very different from the IT outsourcing model. I think when Sachin was talking about the administrative burden and the chores that we had identified in the physician clinic, the instinct was to actually develop proprietary tech to try and eliminate the task altogether. But however, being pragmatic technologists, we realized that technology doesn't always completely eliminate the task. And we realized that it needed a certain amount of human in the loop to be able to completely eliminate the task, which is very different from how IT outsourcing companies actually approach the problem, right? So IKS, if you look at the kind of platform that we have built and the 16 distinct features that form this platform, each of these features are a healthy combination of proprietary technology that IKS has written, along with human in the loop. And what we always strive to do is to, over a period of time, try and eliminate the human in the loop as much as possible. In fact, you will actually find that there are several features on the platform where we have almost 90% tech deployment and barely 10% human in the loop. So that, I think, is a very, very distinctive feature of how IKS has built its platform.
So Sachin, why are you going public? You definitely don't need that cash. So is there a real need for IKS to go public?
Great question, Nikunj. So as you said clearly, the business generates a very healthy amount of cash flows, which is also why we are not raising any primary capital. But the reality is the way our cap table sits, nearly 25% of the company is owned by employees, ex-employees that have really put in 18 years of sweat, blood and tears in the business. And the sole purpose really of the IPO is to give these people that have put in their sweat, blood and tears over the last 18 years some sort of liquidity. And in the process, of course, create a more institutional standing for our organization by going public. Also start to create a bit of an employer brand. Today we are 13,000 people strong globally, north of 10,000 people in India. So it's time to start to create a bit of an employer brand. And in the process then also perhaps create good access to capital in the future in case we decide to need primary capital.
Ditya, can I say that the uniqueness about IKS is the fact that it perhaps could be the only Indian IT company with a play on US healthcare?
Amongst listed entities, I think that would be the right characterization. I think we want to call ourselves a healthcare enablement platform and not an IT company.
Nitya, but given the compulsions of the US healthcare system, like Sachin said, that it's broken down, costs have to come down, the Republicans, in a sense, are committed to bring the US healthcare down. What are the chances that the services which you provide could also come under pressure?
See, I think if you look at the different parts of the value chain in the US healthcare, the provider organization is obviously a very, very critical one. And I think while the intent will remain to reduce the cost across the board from the government, we believe we are actually part of the solution and not the problem, right? If you look at provider organizations, all of them are genuinely struggling and reeling under the pressures of the post-COVID pressures of doctors and nurses having dropped off the workforce entirely, the fact that they're struggling with a huge fixed cost model. And what IKS brings to the table is actually a solution to all of these problems. So we are able to bring efficiencies into the provider organization so they're actually able to deliver care even better. So given that we are part of the solution, therefore, we believe that regulations will actually be a tailwind for us. And the other thing we've always seen, at least historically, is that regulation also tends to add to the administrative burden. And therefore, that actually enables us to expand our platform even further and therefore provide more solutions to these provider organizations.
What would be the shareholding like once the company goes public, just for the benefit of our viewers? What will happen to the promoter equity and what will happen to Rare Enterprises stroke late Rakesh Jhunwala's holding in the company?
Yeah, so together between Mr. Jhunjhunwala's family and my family, our shareholding post-listing will still be close to 65%. And beyond that, employees, ex-employees, and some other HNIs will own close to about, give or take 18, 19%. So, the institutional and retail shareholders that are coming in will own about 16% of the company, and the promoter holding will be just under 65%.
You know, Nitya and me have interacted up team number of times, but Sachin, you and me have just interacted for the second time. When a company goes public, I always tell promoters that, are you sure you want to go public? That means more media scrutiny, more quarterly updates, more interviews to ET Now. Are you really looking forward to it? Are you really prepared for it, Sachin? Every quarter we'll call you, kya ho raha hai, kya hone wala hai?
Only time will tell, Nikunj, but I can tell you that we are looking forward to all the learning and the challenges that come with this next phase of our journey. And I think it's the natural evolution in this company's growth. You know, when I vividly remember when we had started the company in January 2007, in a media interaction, somebody asked Rakesh Bhaiya, when will you take this company public? And you know what his answer was? His answer was, "Abhi to ladki paida hui hai aur aap ladki ki shaadi karane ki baat kar rahe ho." Well, 18 years later, I think perhaps he would say we're ready to go public, and you know it'll be an interesting set of challenges, and hopefully we'll perform in a way where you will continue to be kind to us.
And you know, if I really look at from 2007 to the fact that you're going public, what you've achieved in terms of the top line, the importance, the relevance, and what an entrepreneur can actually do, it's quite staggering. So good luck, Sachin. Nitya, fantastic to connect with you, and we'll keep tracking your IPO as it opens and progresses. Thank you very much for joining us on ET Now.